Hi, this is Dr. Cami Jane of Mindful Family Medicine, and I'll be talking about intermittent fasting briefly today. Intermittent fasting means not eating for 10, 12, 14, maybe 16 hours, depending on your disease process, and letting your body rest during that time. And people often do this a few times a week if they have a disease process they're trying to treat. And when you are fasting, your body goes into a rest and repair mode, which is critical. A process called autophagy happens, and this is where the body digests diseased or old or dysfunctional cells. And in 2016, a Japanese scientist earned the Nobel Prize for his work on autophagy. So if that's something you want to go reference, it's interesting. Therapeutically, I use it with my patients with insulin resistance. So my patients who either are overweight, have diabetes, pre-diabetes, fatty liver disease, and this is very helpful. The second is my patients who need to rest their bowel. So patients with Crohn's disease, ulcerative colitis, even heartburn, this can be helpful to them. The third, and this is a little bit less conventional, I use it in my patients who have mild confusion, fatigue, lack of mental clarity, maybe even mild depression. And this does seem to even out their sugar level during the day. So they don't have that roller coaster of sugar and therefore emotions, and that does seem to help. So you cannot do this without a provider's help if you are pregnant, if you're menopausal and hot flashing, if you are on insulin, and I really don't recommend it for people who eat carbs 3 meals a day as the majority of their food source and have popcorn as a snack. You'll feel miserable if you try this. So you need to talk to a provider about maybe adjusting your diet first. And then how do you do it? You just practice. Edge your dinner earlier, or sometimes have a late lunch and skip dinner. Plenty of fluids, non-caloric fluids when you're doing this. And make sure you have plenty of good fats in your diet, especially if you're doing a longer fast, so over 14 hours. That breakfast, when you start eating, you should have nuts, avocados, eggs, maybe even sardines if you like them, but something that's going to nourish you calorically so that your body knows to expect some good food and it will not panic when you fast. Each time you do it, it gets a little bit easier, and people have told me they feel a lot better. Their stomach feels less uncomfortable in the morning and their attention is better.